Dear colleagues, welcome to B2 Ward. I will share with you our experience with discharge planning for patients in our unit. Discharge from hospital to home requires the successful transfer of information from clinicians to the patient and family to reduce adverse events and prevent readmissions. Engaging patients and families in the discharge planning process helps make this transition in care safe and effective. Evidence showed that nearly 20% of patients experience an adverse event within 3 weeks of discharge, according to one study. One of these adverse events, 3/4 could have been prevented or ameliorated. Excuse me, our physician is doing round right now and I have to be with him.
Mr. Nasser. Surgery site looks clean and no signs of infection. I will discharge you after 2 days when your intravenous antibiotic course is completed. At home I will prescribe oral antibiotic twice daily for 7 days and Clexane injection once daily for 10 days. I will give you an appointment in 2 weeks' time and ultrasound to be done in 10 days with lab from discharge date. I will ask our wound care nurse to instruct your sitter about the wound care. If you have any question, please write it before the discharge date and we will be happy to answer you.
Dear healthcare provider, in our unit we are using Ideal Discharge Planning Strategy and I will explain it to you now. Ideal Discharge Planning Strategy highlights the key elements of engaging the patient and family in discharge planning. Include the patient and family as full partners in the discharge planning process. Discuss with the patient and family 5 key areas to prevent problems at home. 1. Describe what life at home will be like. 2. Review medications. 3. Highlight warning signs and problems. 4. Explain test results. 5. Make follow-up appointments. Educate the patient and family in plain language about the patient's condition, the discharge process, and next steps at every opportunity throughout hospital stay. Assess how well doctors and nurses explain the diagnosis, condition, and next steps in the patient's care to the patient and family and use teach back. Listen to and honor the patient and family's goals, preferences, observations, and concerns. Advantages of ideal discharge planning: improving information accuracy and patient compliance, reducing risk and liability, enhancing the quality of care, demonstrating the importance of patient perspective, reflecting teamwork, improving patient experience, reducing post-discharge complications and avoidable readmission by urgent care drop-in and emergency. Your father physician prescribes Clexane injection, and to my understanding you are the one who will give it at home.
Yes, I am, but I do not know how to give it, so can you please help me and show me how to do that?
Do not worry. Over the next 2 days, before discharge we will teach you how to give it and you will give it under our supervision. Good morning, Mr. Nasser. Today is your discharge day and I brought with me your appointments, medication, lab request, and wound care supply. Over the last 2 days, we trained your son how to change wound dressing and to give Clexane injection. He was excellent and doing great job.
Sure he is.
In this envelope you will find your physician appointment in 2 weeks' time. Also, you have ultrasound appointment which require fasting from midnight. Labs request scheduled early morning in the day of your next physician visit.
Thank you, Rosalie.
In case you have query at home, do not hesitate to call us at our unified phone number or use our application, and we will be happy to help. If you have any question, you can ask or else you can go home.
No, we don't have any question, and thank you, Rosie V.
Dear colleagues, it's very important to provide your patient and family before discharge with both verbal and written instructions. I would like from each one of you to know how to access their patient evaluation scores related to discharge information, to improve their scores and to monitor it. For more information about discharge planning, there will be educational session in B2 Ward next Monday, 5th of September, 2022, conducted by Educational and Awareness Ambassadors Group Number 3 from Patient Experience Office. Unfortunately, I cannot attend because I will be on leave at that time. Dear colleagues, during our educational session, there will be a question and a winner of 1 prize. Pay attention to this video in order to answer the question. Dear colleagues, thank you for attending this video and goodbye.
I received text message from your hospital to evaluate your discharge process.
Sure, they deserve 5 stars for their excellent services.